Hey folks, and welcome back to the channel. In this video we're going to go through examination of the thyroid gland. This is a very important part of medical school exams, very frequent examination question, and it's a very important thing for all doctors to be able to do because lumps and bumps in the neck and in the thyroid are a frequent presentation to the primary care physician. Make sure you stay to the end where I show you how I do it in a very systematic fashion. And a very important pro tip here is the difference between examination of the thyroid, in which case you start with the hands and you work your way around, or if the instructor says examine the neck, in which case you just go straight to the neck. So with that, let's have a look at some do's and don'ts. As with any examination of any part of the body, there are a few basic do's and don'ts. You have to greet the patient, introduce yourself, make sure you've got the right patient. You have to gel your hand, and you have to essentially tell them what you're about to do, why, ask their permission, make sure it's okay with them, and then importantly, do they have any pain? You would do that for any examination. Then you expose the patient. Now this is not, doesn't have to be anything particularly elaborate, but obviously you need to examine the neck. You need to take off any jewelry if the patient has any, so that you can see the whole of the neck and the upper thorax. If appropriate, you may need to get a chaperone, of course. The positioning of the patients is usually with the patient sitting up in a comfortable position. You have to pay attention, and you have to mention this in the exam, that you would pay attention to the patient's privacy and dignity. It's always a good idea to have a glass of water by the side of the bed or side of the table. And again, as with any examination, there's a certain sort of fluency and the economy of movement that you should have, and the sort of banter and the instructions with the patient that examiners pay particular attention to. It's very important. Once you've done that, then you start with inspecting the patient's hands. As a general rule, it's a good idea not to touch the patient unless you really have to. You get them to hold out their hands and you inspect their nails for any thyroid acropathy. You get them to turn their hands over, and then you can touch them. You can feel their palms for any sweatiness or sort of clammy, sweaty palms. Then you get them to hold out their arms, and you put a sheet of paper across to see if it sort of trembles or shakes a little bit, and that's for fine tremor of thyrotoxicosis. Then you check the patient's pulse. So for example, in thyrotoxicosis, there would be an AF, and you check their reflexes and their blood pressure, and then you move on to the patient's face, and you look at their eyes for this classic appearance of exophthalmos, which is kind of bulgy eyes, to do with immune complex deposition around the periorbital fat. The best way to examine exophthalmos is to stand behind the patient, tip their head back a little bit and look from above, or you can look at them in the profile view, and the giveaway is when you can see the white of the eye above the cornea, so the upper limbus. You can see the white of the eye above that. Some of the other changes in the eye in the thyroid exam include lid retraction, as the name suggests, and this is a static thing. Its dynamic equivalent is lid lag, which I'll show you in the examination shortly. Exophthalmos, which we've mentioned. Then there's a degree of ophthalmoplegia, so there's diplopia to do with a range of eye movements, and then chemosis, which is edema of the conjunctiva in very severe cases. Once you finish with the eyes, you move on to the neck. And as with any examination, again, you stand back and inspect for any obvious lumps and bumps, any asymmetry, any scars, any skin changes, or any goiter, which can be diffuse all over the thyroid, or it can be multinodular, in other words, localized. Then once you're finished with the inspection, you start with a palpation. And the best thing is just for me to show you this. So let's have a look at the examination of the thyroid in a bit more detail.
Hello there, my name is Amir. I'm one of the medical students here. I've been asked to examine your thyroid today. This would involve me having a look, having a feel of your neck, and having a listen to your neck. Will that be okay with you?
Yeah, that sounds okay.
Do you have any pain anywhere?
No, I'm okay.
Can I ask you to confirm your name and date of birth for me, please?
Yeah, it's Patrick, and it's the 17th of March 1990.
Thank you. Just I'm standing back from the end of the chair, and the patient looks comfortable at rest. He's not particularly restless or agitated or listless, and he's appropriately dressed for the room temperature. I'm going to have a look at your hands. Is that okay? Can I get you to put your hands out for me, please? Just checking his nails and the general tremor of his hand, and I will elicit that by putting a sheet of paper across there and just having a look for any fine tremor. Thank you. Can I get you to turn your hands over for me, please? I'm just checking to see if there's any temperature changes, any warmth or any clamminess and sweatiness to his arms, to his hands. Thank you very much. I'm just going to check your pulse while you're there. I'm checking it for rate and rhythm to see if it's any tachycardia or any AF. Thank you. At this point, I would offer to do the blood pressure and check his reflexes. Moving on to his face, I'm checking for any exophthalmos, any bulgings of his eyes, any lid retraction, any loss of the outer third of his eyebrows, and I'm going to check for lid lag. Can I get you to follow my finger down, please? So I would inspect his neck for any obvious asymmetry, any goiter, any lumps and bumps, any scars or any skin changes. And I'm going to check for a thyroglossal cyst. Can I get you to stick your tongue out for me, please? Thank you. And I'm just going to ask you to take a sip of water and hold it in your mouth. And please don't swallow it until I ask you to. And I'm going to move to the side, and can I ask you to swallow now for me, please? Thank you. I'm going to move behind you now, if that's okay. And just palpate your thyroid, just above the clavicle and the suprasternal notch. Could I ask you to take another sip of water for me and hold it in your mouth? And can I get you to swallow again for me? Thank you. And I'm going to check your lymph glands in your neck, starting with the submental, submandibular, preauricular, postauricular, and the occipital groups, as in a ring. And then I'm going to check your cervical chains, anterior to the anterior border sternomastoid, both sides. And check the supraclavicular fossa, and take my right hand away to check for Virchow's node. Thank you. I'm just going to tap on your chest now, if that's okay.
Okay.
So I'm going to start low down. That's for checking for retrosternal extension. I'm going to have a listen to your neck, if that's okay. Thank you. Could I ask you to put your arms across your chest and try to get off the chair for me, please? Thank you. And can I ask you to expose your shins by pulling up your trousers for me?
You look at the patient's shins for something called pretibial myxedema, which is a characteristic skin changes on the shins, and also you get the patient to stand up without using their hands to check for myopathy.
Thank you. That's good. So Patrick, thank you very much. This concludes our examination, and I'll turn to the examiner and present my findings. Thank you.
As ever, thank you very much for watching, and I hope you did get some value out of this video. If you did, I'd really appreciate it if you can give it a thumbs up. The button is just down here somewhere so that your colleague can discover it and hopefully benefit too. Thank you very much again, and I'll see you on the next one.
Hello Michael, my name is